Record on this. Hi there, my name is Laird Christensen. I direct the Masters of Science program in Resilient and Sustainable Communities here at Prescott College. And if you've been following along with our community resilience conversations, you'll know that we've been trying to talk to a number of people who have been on the front lines of dealing with the global pandemic, whether they're graduates, alumni, current students, or just members of the community. And one of the perspectives that we haven't had a chance to have represented as much as I would like are people actually working in the medical profession. So today I have with us an alum, Claire Davis, who is the clinical manager for the Vail Clinic in Vail, Colorado. And she's graciously taken the time to talk with us for a few minutes about the experiences that she has had dealing with coronavirus up in Vail. So welcome and thank you very much for being with us, Claire.
Thank you, Laird.
Could you tell us a little bit about the job that you have and the population that you work with up in Vail?
Sure. Vail, Colorado's kind of unique in the fact that we have Vail Resorts. It's a very touristy, transient county that I live in right now. So we get people from all over the world for numerous reasons. We have the Vail Resorts, the skiing, world-class skiing at Vail Resorts in Beaver Creek, as well as we have Steadman Philippon Research Center, which is a orthopedic hospital-based research center, as well as world-renowned surgeons who do orthopedic surgeries. So we have people from all over the world coming for surgeries. We have people from all over the world coming just to ski at the Vail Resorts and things like that. So super unique place. And then there's several thousand, obviously, that make it home as well. So super unique county itself. But yeah, and I am, as you said, I'm the clinical manager of the Vail Clinic. We have a hybrid system of family practice clinics throughout the valley, as well as and we have recently merged with the Vail Health Hospital System. So we've kind of merged, we work together throughout the entire county. There's about 50,000 residents. I would say a fair amount of that is transient, has half-time homes here, half-time homes in Florida or other places in the world too. So very unique location.
Yeah. Well, I'm wondering how the community of Vail was hit by coronavirus when it broke out. Did you have a lot of warning? Were you well prepared for that?
I think we were pretty blindsided, like most of the rest of the US. I mean, yes, there was stuff coming out about Italy and things like that. We did have a small high school group coming back from Italy at the end of February, where everyone was extremely worried about that group, and we quarantined them right away. I think our first positives were at the very late February, early March. But because, like I said, such a touristy area, we kind of exploded really early. And as soon as we got our testing, our numbers skyrocketed. We were definitely a little bit overwhelmed. We had to designate two of our clinics to specialty clinics that only did walk-in COVID testing and or healthcare for those specific types of people, respiratory. We shut down all other specialties. We have all the specialties you could possibly imagine, cardiology, OBGYN, all of those other things that come to our clinics as well. And we shut down the Vail Clinic as well as the Eagle Clinic to be only COVID clinics themselves. And we kind of kept our Avon, which is our big hub in the center of the valley, as the Well Clinic. So all of the things that we needed, urgent cares, well baby checks, newborn checks, things like that, elderly populations that just needed to go in for medications or to get things checked out, we kept the Avon Clinic, the Well Clinic. So we are still going with the Eagle and Vail clinics as COVID-specific clinics. So, but we are hoping we're on the downslope. It seems like we've really leveled off recently. So we think we peaked right around mid-March, had the highest numbers of positives come back once we got our testing in place and things like that. But yeah, for the most part, we've been getting lower numbers. We've kind of, even in the Vail Clinic, my clinic specifically, we've gone down to only one provider seeing respiratory throughout the day, and we're open from 8 to 6 p.m. during the week. So one provider for those hours, that's actually speaking pretty good in volumes of who we are seeing now in the Valley, and it's definitely slowed down a lot. So that's good.
I keep hearing about a high percentage of false negatives on the testing. How confident are you as a health professional about the quality of the testing?
That's definitely a tricky one. We've been telling people that the false negatives are around 30%, which is pretty high. So basically what we've been doing as a healthcare professional and as a clinic as a whole, we have been, looking at the person themselves. If they're feeling better, if they've got nothing going on, they, had 2 or 3 weeks of symptoms, and, their symptoms are getting less and less, and they're doing okay. And they came back negative, we're saying, it's possible that you had it, but as long as you're feeling better, we're great with that. There's definitely a small percentage of people who are coming back in at that 3 and 4, even up almost 5 weeks mark with that had a negative, but definitely are presenting with the COVID pneumonia, the more crazy symptoms where they're having difficulty breathing, they're having that sudden onset within 24 hours of their oxygenation saturations going down really low and having to be hospitalized for a short amount of time and things like that. So we're definitely seeing that population still coming through our clinics, but like I said, it's coming less and less, so that's good.
I wonder if Vail just, I have the image of it as a community that has a fair amount of privilege. And I wonder if that manifests itself in terms of behavioral changes towards containing coronavirus, more so than we might see in other communities. What are you seeing around you in Vail?
Yeah, we definitely have, it's a tricky situation here. We definitely have those $40 million homes that are either a full-time residence from, definitely we had the Betty Fords had a home here and things like that. We have the Betty Ford Gardens. There's definitely some high-end homes as well as celebrity style people who live here, and the privilege is definitely here. But we also have several trailer parks. We have, the low income people who are on Medicaid and receiving food stamps. We definitely have the full spectrum of community here. But like you're saying, privilege-wise, I think because of Vail Health's poll, we probably got testing a little bit sooner than other locations. And I think that definitely helped our community in seeing that, yes, our numbers are definitely, rising and things like that. And we need to do things as a community and pull together now, prevent kids from going to school. We don't need to go outside of the homes unless it's for essential things like grocery shopping or medical appointments and things like that. So I think overall being able to see that our rates and exposure was going high initially helped the community itself kind of band together and decide to stay home and follow rules and regulations and things like that. So.
I've seen stories of some Colorado mountain towns that are basically not allowing outsiders in across the town lines. Is there any of that kind of sense of protectionism going on in Vail?
We don't. We have that main vein of I-70 that is like a huge interstate system throughout the entire west of the United States. So we still are getting a fair amount of people off the highway. We see people coming from Denver or other states going through to try to get to Utah, which is what generally happens at this time of year when it starts warming up. A lot of people flock to Utah for mountain biking and things like that. So we're definitely still seeing that on the highway. As for a community itself, like mingling, there's definitely some second homeowners that have decided to come up here because we've gotten it together early and we're containing it pretty well. But no, we're not, we're not kicking people out or not allowing people in. I've heard rumors that Telluride is doing that the town has basically shut down and you are allowed to drive through, but you are not allowed to stop anywhere. I've also heard rumors that there was a millionaire that decided to test everyone in the town. I don't know if these things are true or not. Who knows? But as a town, it sounds like they've kind of shut down. And there may be other areas that I'm not aware of in Colorado that is doing that as well. But
Well, you mentioned that people aren't getting out except to go to the store, essential services, that sort of thing. And yet Vail has a reputation as a recreation mecca, and certainly with the trails and the ski resorts and that sort of thing around here. Do you see people out recreating?
All the time. So that is definitely something that people um, are definitely continuing to recreate. There's people out all the time on the trails, on the neighborhood bike paths. What we've recommended as a county is recreate from your house. Try not to drive to trailheads and things like that. We are definitely still seeing 30 and 40 cars at the beginning of trailheads. So people are definitely still doing that against our better wishes and things like that. But for the most part, we just moved in the last month down to Eagle, Colorado, which is a little bit further down valley from Vail, but more of the family-oriented town, if you will. And there's definitely people out all the time, walking the dogs, running, biking, taking the kids for walks and things like that. So, but for the most part, everyone's still adhering to wearing the masks and doing the social distancing, which is, I think, really a good, I think that's definitely been helping our county in general to maintain that slope down. And hopefully we'll be reopening things soon and can kind of start paving the way for that and do it correctly, and hopefully pave the way for other areas in Colorado to be able to start opening up and getting the economy back and things like that.
Yeah, it's tricky because I guess we don't really know what correctly looks like until
Exactly.
you've actually done it and had good luck with that. Well, I don't think any of us really saw this coming, although maybe some of us should have. What lessons have you learned as a healthcare professional from coronavirus that you're going to take with you and may lead you to think differently about the kind of work that you do?
It's still tricky. We went through this surge of, oh my gosh, we don't have the proper equipment to take care of the surge of patients that are coming through. We don't have the amount of staffing that we need. And now we're on the downslope, and now we have too much staff and too much of everything, and we're not really sure how to go about this. And I'm not sure that we've learned much from it, honestly. I'm not sure that it's something that we can truly prepare for. Um, I'm not in higher management. I'm kind of in the mid-level of management. I definitely have some tiers above me to figure out what is going on. Do we hoard and keep PPE in the back hallways because we may have another virus outbreak, or do we just go through this whole system again of doing our best when we are faced with this kind of situation? But like I said, we didn't have the staff initially, and now we're on the downslope, and we have too much staff. We're talking about potentially furloughing people, which is terrible in the healthcare field because eventually we will need them again once we come back up to our normal amount of uh, people coming in for physicals, and people will get more active. Mountain biking will start up here soon. We'll get a fair amount of crashes from biking and things like that. So it's definitely interesting. I don't know that I can say I've learned anything from it yet, except for the fact that mental resilience is probably one of the biggest keys. And in this valley, we definitely upped our mental health telehealth. So there were a fair amount of people. We actually had hired multiple people right before this happened to start a big mental health movement in this valley. And then we also, during this event, were able to chat with several people from down at like CU Denver, and get a couple of nurse practitioners that would be offered their help and time to do some telehealth appointments for people who are struggling staying at home with kids and trying to work and things like that during this time. And then we actually had 2 retired psychiatrists offer their time as well. So I think that's probably the biggest thing is, it's hard on everyone to suddenly have a new way of life. Um, whether you're a mom and dad that work 10-hour days and suddenly you're working from home, but you still have to homeschool 3 children, that is amazing. And I have no idea how those parents have done it. We have one, and I've been working full time, but my other half has been lucky enough to be able to work from home. So he's been home with her for 5, 6 weeks now, and doing an amazing job with her as well. So I just give props to pretty much everyone that's been able to do that and maintain their mental sanity throughout this whole process. So yeah.
Well, I think that's right. We've all had to make adjustments, and the lessons that we're learning from it probably won't become apparent to us for some time down the road. But when we look back, we will be, I think, better prepared for other kinds of emergencies. I'm so grateful to you and to the other healthcare professionals for the work that you've been doing. We're all counting on folks like you, and anything we can do to make your job easier.
Not at this time. Basically, just get back to normal, and hopefully everybody kind of recovers from this as best as they can. And yeah, like you're saying, hopefully we can learn something from down the way. But right now, in the thick of it, it's hard to think of what we can learn at this moment. Whether just kind of having a disaster plan in place and things like that, or just maybe we'll have a new tactical team that comes out about this and literally just figures out, in the event of these giant virus pandemics, how do we handle all of this in the future, or what could have we done better, what can we do better in the future, and things like that. So
Mm. Well, I sure appreciate you taking the time to talk with us.
for
Again, this
sure.
is Claire Davis, who's the clinical manager at the Vail Clinic in Vail, Colorado. And it's nice to see you again after a number of years. And
Good to see you as well.
best wishes to you and your family.
For sure. Thank you so much.
All right. Um, Forgive me. Oh, there we go.